Again, the Alma eHealth project has been launched. This initiative aims to bring about an integrated and efficient healthcare ecosystem by leveraging technology. Well, to discuss this further and tell us what this is exactly about, I'm joined by the founding CEO of Alma Clinics, Sibongile Manganyi Rath. Sibongile, good afternoon. Welcome to today, and thank you very much for joining us. I understand you launched Alma eHealth on Saturday. How did the launch go?
It went well. Good afternoon, Braden, and good afternoon to the viewers at home. Thank you for having me here. The launch went very well on Saturday. Thank you.
What's Alma eHealth about? What's this new Alma eHealth IT platform in a nutshell?
Basically, Alma eHealth is a clinical decision support platform, meaning that it's a platform that actually leverages an artificial intelligence layer to be able to assist a nurse to take complex clinical decisions on site without necessarily putting the patient's health on risk because of lack of medical equipment or knowledge as well on dealing with complex conditions.
So does it live and operate on a device?
So it's basically a software. If I may just quickly share, Braden, as well, in terms of why we even decided to come up with such a solution. If you look at our context, particularly in South Africa and the entire sub-Saharan Africa, we have a chronic shortage of doctors, and then also with experienced doctors as well. And some doctors have left the industry because of challenges in terms of working environments and so forth. So, but then at the other hand, we have a lot of nurses within the continent, even in our country as well. But then what we've seen is that you are seeing that the disease is, the burden of disease is growing faster than we can produce experienced people to deal with it. So if you look at some chronic conditions, you'll never find a person with one chronic condition. You might find that a person has probably diabetes, hypertension, and HIV. And if you look at all these conditions, they need to be treated at primary healthcare by a nurse, which then becomes very complex for a nurse to see. Let's say we have ratios of 1 nurse to 200 patients a day. So there's just no way anyone can be able to really look at giving good quality care by themselves, deciding on their own. But then, so what we decided to do is how can we leverage technology to be able to, obviously this is a cloud-based technology that can be downloaded in a mobile device. And then it allows a nurse to be able to basically take your blood pressure or your sugar, blood sugar, and then obviously push it into a medical equipment. Those results are pushed into our application, which is Alma eHealth. That then allows, the application actually does the diagnosis, and it also suggests the treatment to the nurse on the spot. So in that way, you know that from a patient safety in terms of diagnosis, it's correct. And obviously when the diagnosis is correct, treatment will also be correct as well. So that's what basically Alma eHealth is about. And what we decided to do is to first launch it into our own clinics that we own. And then obviously Saturday was basically to expand the service into obviously another segment or another market as well.
Will this
where we take it to people's homes.
Okay, I was about to get there. Will this only be available via your clinics, or are you going to be spreading its footprint that I could use it at home as well?
Absolutely, absolutely. We basically launched it in our clinics in 2020, and all of our clinics are basically in the township. Our first clinic was in Protea Point, and we launched it during very difficult times, when we had the lockdowns. We've grown to about 5 clinics at the moment, the physical clinics. The fifth one is in Cosmo Mall. They're all nurse run, because the whole approach was how can we improve the lives of nurses in terms of their working conditions? How can we empower them to take decisions? Okay. So we have about 5 clinics. We started seeing about 98 patients per month. Now we see over 3,000 patients per month. And the consultation fee is 260 rands in our physical clinics. And then we realized that as well, people in terms of barriers, right? Barriers in terms of access to healthcare. If you look at people within our townships, the biggest barrier is the cost.
Yes.
Because obviously it's cost. While if you look at the market that we are obviously addressing with taking healthcare services to their homes, it's really about time. So professional working women, they don't have time to go and queue and wait for the doctor, and sometimes the doctor is late, because there are work demands. While our home care allows a working mom, when they have a child, they can basically go into our app, choose the time that works for them, and the nurse basically would actually bring care to their home.
We get the picture. We don't have much time left. Very briefly, you've mentioned in so many clinics in the townships and such areas. Very briefly, the healthcare professionals, are they embracing this new Alma eHealth platform that you've just launched on Saturday?
Absolutely. I mean, if I look at our team, it creates efficiency in terms of them. There's no paper that they're using, so we are completely a paperless clinic. So Alma is a digital clinic because there is no paper that they're using anymore. Everything is done electronically, and it allows the patient to also own their medical records as well. So it creates a lot of efficiency as well for them, and also knowledge building, because the decision support allows the nurse to learn from the technology as well.
Okay, and it doesn't cost too much?
No, it's free to the patient, right? So so now, Braden, if you come to our clinic or if you come to your home, whatever that the nurse is going to do, you basically are going to own those medical records, because ultimately they're yours. And this is part of empowering the patients as well. So it's basically free to the patient. You can download it on all the Apple Store or Google Store or Huawei Store as well.
Thank you very much, Sibongile Manganyi Rath. She's the founding CEO of Alma Clinics. They've just launched a new, what sounds like a game changer in terms of the healthcare service. So check them out and make up your mind. They are present in a number of clinics in townships in and around South Africa.